Hey everyone, welcome back to the channel. Today, we're diving into a fascinating and incredibly important topic in immunology, a rare genetic disorder that impacts how our body fights off infections. Have you ever wondered how your white blood cells, those crucial defenders, get to where they need to be when you have an infection? Well, what happens when they can't? That's what we're here to talk about today. Leukocyte Adhesion Deficiency, or LAD. Before we dive deeper into what goes wrong in LAD, it's crucial to understand how things are supposed to work. Our white blood cells, particularly neutrophils, need to travel from the bloodstream to the site of an infection to fight it off. This process is called leukocyte extravasation, and it happens in four steps. First step is margination. Think of it like this: the leukocytes, which are normally flowing in the center of the blood vessel, start to move to the edges or margins of the vessel. The second step is rolling. Once they are at the edge, specialized molecules called selectins on the surface of the vessel lining, the endothelium, interact with leukocytes. This causes the leukocyte to slow down and literally roll along the vessel wall. The third step is adhesion. This is where things get serious. Another crucial set of molecules called integrins on the leukocyte surface bind firmly to the other molecules on endothelial cells. This firm adhesion completely stops the rolling leukocytes. Transmigration, also known as diapetesis, once firmly stuck, the leukocyte then squeezes itself between the endothelial cells and migrates out of the blood vessel into surrounding tissue and straight to the site of infection. Leukocyte adhesion deficiency occurs in three main steps, each defined by a specific molecular defect in the leukocyte extravasation pathway. LAD type 1, this is the most common form. It results from a mutation in CD18, a crucial component of the integral molecules. This defect prevents firm adhesion of leukocytes to the endothelium, blocking their exit from blood vessels. LAD type 2, this type involves a defect in a glucose transporter, leading to impaired synthesis of selectin ligands such as Lewis X. This primarily affects the initial rolling of leukocytes along the vessel wall. Last but not least, LAD type 3 caused by a defect in kindlin 3. This type impairs the activation of all integrins, affecting both leukocyte adhesion and platelet function. This leads to severe infections and a bleeding tendency. So, what does leukocyte adhesion deficiency look like in a patient? The inability of white blood cells to reach infection sites leads to a characteristic set of clinical features. Delayed separation of the umbilical cord. This is often one of the earliest and most striking signs in newborns, typically lasting longer than 30 days. Recurrent bacterial infections. Patients suffer from frequent infections, particularly infecting the skin and mucous membranes like the mouth. A hallmark sign is the absence of pus inflammation despite active infection. This is because pus is primarily composed of dead neutrophils, and if neutrophils can't migrate to the infection site, pus can't form. Poor wound healing. Due to impaired inflammatory response and immune cells presence, wounds struggle to heal properly. Patients often experience severe periodontitis, gum disease, oral ulcers, and other skin lesions. A key laboratory finding is neutrophilia, meaning an elevated count of neutrophils in the blood. As shown in a diagram, normally about 50% of neutrophils are margined or temporarily stuck in the lung vasculature. In LAD, because adhesion fails, these neutrophils dislodge and circulate freely, leading to a persistently high neutrophil count in blood tests, despite a lack of neutrophils at infection sites. Lastly, hypopigmentation or lighter skin and hair is sometimes observed, particularly in LAD type 2, due to its specific underlying genetic defect affecting glycosylation. These symptoms, especially in combination, strongly indicate a potential diagnosis of leukocyte adhesion deficiency. So, how do doctors find out if someone has LAD? It involves a few important steps. Blood test, CBC. The first sign is often a regular blood test called a CBC, complete blood count. It still shows a very high number of white blood cells called neutrophils in the blood. Even with infections, these cells stay in the blood instead of going to the infection site. Flow cytometry. Doctors do a special test called flow cytometry. This test checks if the sticky parts, adhesion molecules in the white blood cells are missing or not working. For LAD type 1, they check for something called CD18. For LAD type 2, they check for other sticky parts called selectin ligands. Gene test. To be sure, doctors do a gene test. This test looks for specific problems in the person's gene that cause LAD. Early signs. Sometimes the first big clue is when a baby's umbilical cord takes a very long time to fall off, typically more than 30 days. By using these tests and looking for these signs, doctors can accurately find out if someone has LAD. So, if someone is diagnosed with LAD, what can be done to treat it? Here are the main treatment options. Antibiotics. Since people with LAD get many infections, giving antibiotics quickly is very important. These medicines help fight and control infections. Bone marrow transplant is the most important treatment because it can actually cure LAD. In a bone marrow transplant, healthy cells are given to the patient, which can then make normal working white blood cells. This is a very serious procedure, but it offers the best hope for a full recovery. Gene therapy is a newer treatment that is still being researched. The idea is to fix the faulty gene that causes LAD. It's not a standard treatment yet, but it shows promise for the future. Good hygiene and infection prevention. Because infections are a big problem, it's also a very important thing for the patients to practice excellent hygiene, like washing hands often, and try to prevent infections as much as possible. This includes good dental care to prevent gum infections. These treatments aim to manage infections and ideally correct the underlying problems with the immune system. Thanks for watching. If this video intrigued you, don't forget to like, subscribe, and join me next time as you uncover more mysteries of medicine. See you next time.